I'm Dr. Mila Harrison. I'm the Acting Executive Deputy Commissioner in the Mental Hygiene Division at the New York City Department of Health and Mental Hygiene. And I am so pleased to have you all here for what is the second of our series of sessions for mental hygiene providers, for behavioral health providers around COVID-19, the updates we have for you, and opportunities for discussion. And I am really pleased to be joined by a guest presenter today who you'll hear from in a short while, Dr. Camille Clare, and I will introduce her more when we get to right before her presentation. So I want to start off by giving just a high-level update on where we are when it comes to COVID vaccinations, and from a New York City perspective. And then again, you will hear from a women's health perspective. We heard the last time we gathered with providers that people wanted to hear more about issues related to fertility and concerns that are out there in the community. And we wanted to be able to give you the most up-to-date information so that you could take that back to your staff and clients as well. So that will be the topic from a presentation perspective. I want to make sure that you all realize we're going to leave time for conversations and questions, and want you to raise questions and concerns, certainly about the topic for today, but also if you have other questions that are coming up, we want to be able to answer those as well as best as we can. And we will continue to have these conversations because I know we're not going to get to all of the issues and concerns that you'll have. So even before I get started, I want you to think through questions that you have, and please, you can at any point start putting them in the Q&A box so that we can start gathering them and get back to you on that. So let me take us to the next slide. So again, today we're going to go over some vaccine updates. We're going to hear about women's health and vaccine issues, and then give an opportunity for Q&A. Next slide. So today, you're hearing from me right now, Mila Harrison. As I mentioned, you will shortly hear from Dr. Clare. I'm also joined by some of our experts at the health department, both from an immunization and vaccine perspective, as well as from mental health response perspective. So Doctors Jennifer Rosen, Dr. Benkel, and Dr. Fisher are joining us as panelists as well, so that we can best answer your questions. Next slide. So let's jump into where we are from a vaccine administration perspective. You can see on the left the data for the US, total vaccines administered and the number of people fully vaccinated. If you look at New York City specifically, and this is current as of noon today, we have had over 2.5 million people fully vaccinated in New York City and have administered in total almost 6 million doses, 5.89 million doses. So we are well on our way to getting many New Yorkers vaccinated. Next slide. Information that's available on our website that we hope that you access, that I want to just highlight for you, that vaccine coverage for New York City, specifically for residents of New York City, is that we have 49% who have received at least one dose of vaccine. And if you look at that demographically, and again, that's for the adult population, the 49%. And out of that, that's 32% to about 2 million who have been fully vaccinated. If we look at the breakdown of vaccinations by borough, we can see on the bottom of this slide that 39% of people from Manhattan have been fully vaccinated, which is higher than the other boroughs, and where our rates are lowest are in Brooklyn and the Bronx at 27 and 29% respectively. So we have work to do for sure. Next slide. This slide breaks down vaccination rates by ages, sex, and by race and ethnicity. And if we look at the percent of people by age who have been fully vaccinated, we have the highest rates in the 65 to 74 group and in the 75 to 84 group. Again, fully vaccinated at 57 and 53%. And you can see the gray bars that show the percent who have gotten at least one dose. And pretty even for women and men, although slightly higher among women at 33% compared to 30%. I'm looking at the fully vaccinated group. Again, you can see this almost half, 49 and 47% for at least one dose. And when you look at this by race and or ethnicity, our highest percentages are in the Asian populations and in white individuals, with lowest percentages of vaccination fully and or at least one dose in people identifying as Latino or Black. And so we know from a disparity perspective, we still have work to do. Next slide. This slide is probably way too much information, but just to share the breakdown by boroughs and ages, by sex, and by racial/ethnic categories as well. And again, this information is accessible on our website, but then you can see where the highest ages are getting vaccinated. Again, highest ages in the 55-65 group, still highest in Manhattan, as you've seen. Next highest in that group for Staten Island. Again, somewhat evenly distributed female and male across the city, with some variation across our boroughs as well. Again, and you've seen this in the other slides, where Manhattan is higher than the other boroughs. And by race and or ethnicity, we see highest rates for the group of Asian and Native Hawaiian Pacific Islanders at 59% across the board, and somewhat consistent with lower rates in the Bronx, even for this group, and lowest rates across the board, across all boroughs for Black individuals, and somewhat for Latino, Latinx individuals, with a slightly higher rate for Manhattan than the other boroughs. And you can see the rates for white individuals as well. Next slide. I also want to point out what you guys likely all know and have been hearing, is that the Johnson & Johnson vaccine, Johnson & Johnson/Janssen vaccine, has been put on pause at this moment. And there will be another meeting of the Committee on Immunization Practices, the ACIP group, this Friday, where I think people are anticipating a further decision will be made. What I want to say is that out of the 6.8 million doses of the J&J vaccine administered nationally, there have been 6 reported adverse events of a very rare event called cerebral venous sinus thrombosis after receipt of the vaccine. Out of an abundance of caution, the J&J vaccine administration in New York City is currently paused, and people who have been scheduled to receive that vaccine are being offered Pfizer or Moderna vaccine instead at this point in time. And we continue to administer the Pfizer and the Moderna vaccines across New York City. And more will follow on that, I believe, after the Friday meeting. Next slide. So before I move into introducing Dr. Claire, I want to add a few other updates on vaccine-related information that's important to the network of providers, and that is that we have walk-in capacity for individuals who are 50 years or older with a companion who's eligible at something like 30 of the city-run vaccine sites, and that information is accessible on our website. So people can walk in without having to make an appointment ahead of time. We also know from our own data that COVID-19 hospitalization among seniors, among elderly folks, has gone down 51% since mid-January. And among folks under the age of 65, hospitalization has gone down 29%. And we attribute those decreases to vaccine efforts. We also know, as I presented earlier, that more than 61% of New Yorkers over the age of 65 have received at least one vaccine shot. And so that is good news for us in New York City, in that access to vaccine is much easier than it was 2 weeks ago even. And we know that the work we have ahead of us is still moving toward greater vaccine confidence among individuals who may still remain hesitant or unsure of vaccines. And again, we have a lot that we need to take some responsibility for to move that along. So at this point, I want to introduce Dr. Camille Claire, who was gracious enough to join us with not a lot of lead time in this presentation. Dr. Claire is a board-certified obstetrician and gynecologist. She received her medical degree from Albert Einstein College of Medicine in the Bronx and completed her OBGYN residency at the State University of New York at Buffalo. She obtained a master's in public health and health policy and management at New York Medical College, and she is a certified physician executive as conferred by the Certifying Commission on Medical Management. Before her current job as chair and professor at the Department of Obstetrics and Gynecology at SUNY Downstate Health Sciences University College of Medicine and School of Public Health, that's the role she has now. She had been Associate Dean of Diversity and Inclusion at New York Medical College and Director of Resident Research for the New York Medical College Department of Obstetrics and Gynecology. She has won numerous teaching awards and really comes well regarded with excellence in teaching and other honors, such as being inducted into the Alpha Omega Alpha Honor Society in May of 2018 as a faculty member. So let me see what else I want to tell you about Dr. Claire. I think there's lots of other things she does. I think at this point, I'm going to turn over the mic and the camera for Dr. Claire to share with you information that you've been clamoring to hear about. Dr. Claire, the floor is yours.
Thank you so much, Dr. Harrison, and thank you for your kind introduction, as well as giving me the opportunity to speak. I've done several presentations regarding issues pertaining to what I do for a living. I don't espouse to be the expert in the room on infectious diseases, nor on the COVID vaccine in general. However, several questions come up to those of us as obstetricians and gynecologists regarding pregnancy or pregnant persons, lactating persons, and issues around fertility. So I'm always happy to speak about that and lend whatever expertise that I have. I am a member of the American College of Obstetricians and Gynecologists and actually serve as the chair of District 2, which represents about 5,000 OBGYNs in the state of New York. And so I always like to thank my colleagues and the staff in the office in Albany for helping me to create these slides. Several of our best practices started about a year ago when many of us were frontline workers and working in the field. taking care of these patients when we didn't know that much and really had to learn from each other about what to do. And we continue to offer our expertise as it becomes available, which, as mentioned, is an ever-changing landscape. So hopefully this will be mostly a conversation, and thank you to the other colleagues from the New York City Department of Health and Mental Hygiene for offering their expert opinion and expertise if questions come up that I may defer to them. So next slide, please. So as mentioned, or maybe it may be well aware for you, for pregnant persons in particular, when they are hospitalized with COVID-19, the impact of the illness for them is severe compared to non-pregnant persons. So about half of women who are hospitalized have symptoms, but many hospitalized pregnant persons may have severe outcomes such as ICU admission, being on a mechanical ventilation, and even dying. So even though vaccination thank you to your department, your organization, for doing the great job that you are in getting the word out regarding vaccination. As you've heard, a lot more work to be done. We still do recommend for pregnant persons to really continue to do the same measures that we recommend for non-pregnant persons, including wearing your mask in public, staying 6 feet apart, washing your hands, and continuing to receive prenatal care now that we're opened up much more and are able to provide in-person services, as well as telehealth, which is still being provided. We recommend that people do that to obtain their care. So next slide, please. So a lot of the information that we've obtained really has come from guidance from the American College of Obstetricians and Gynecologists, as well as the Society for Maternal Fetal Medicine, which is a subspecialty of ACOG, which has really helped us provide information for our patients that are pregnant or lactating. So ACOG does recommend that vaccination should not be withheld from pregnant individuals, so that a pregnancy test is not required before someone goes in for vaccination. It should not be asked, and patients may be vaccinated at any time during the pregnancy. The one caveat that I've heard from my colleagues when we've presented together is that sometimes in the first trimester, because of some of the side effects of vaccination, including fever, and worries about febrile illnesses being related to any untoward consequences, some patients may feel that they would like to wait beyond the first trimester, although that's not a recommendation that we need to necessarily withhold that. We also do say that pregnant persons can make their own informed decision about vaccination under the advice of their obstetrical provider or their OBGYN, so they can make the appropriate choice of what to do based on their own personal risk in addition to the pregnancy. So pregnant individuals may have other comorbidities which increase their risk of severe illness, as we mentioned, even more than just the pregnancy itself. And so again, that it should be an informed one with the person's obstetrical provider. So next slide, please. So in terms of just some safety data, the most recent data that I could find is as of April 15th, just 3 days ago, there have been over 94,000 pregnancies that have been reported to the CDC V-Safe registry, with no safety issues that have been observed so far. And so maybe a few months ago, this was about 30,000. So this is people who were pregnant at the time that they received the vaccine. They may not have known, and over all this period of time, these are some of the outcomes. And several of our OBGYN colleagues have shared their experiences and their own decision making. So these, many of these were frontline workers, healthcare workers who've received the vaccination, when they could, and they were pregnant at the time, and have really kind of shared their own decision making, shared decision making, and how that has impacted their own decision whether or not to receive the vaccine. We do have a public facing website on acog.org/women's health. So there's a lot of information that again can help your patients make the appropriate decisions as mentioned. Next slide, please. So this data is a little bit old, so forgive me with that. This is data as of February 18th, 2021. We mentioned regarding the, the fact that these issues can change over time, but this is the most recent data that I have. This is a website from the CDC that's noted here that you can look up even more recent data beyond February. And so if you look at the background rates of someone having a miscarriage in the first trimester or less than 20 weeks, the background rate of that happening is about 1 in 4, about 26%. And what was seen in patients that received the vaccination, that was around 15%. So no greater of someone having a miscarriage when they've received the vaccine compared to the baseline rate. Some of the other complications noted here, for the most part, have also been around the same or slightly less in those who've received the vaccination. Pregnancy complications such as gestational diabetes, hypertension during pregnancy or preeclampsia, growth restriction of the fetus, and any neonatal complications such as a preterm birth, congenital anomalies, having smaller babies than expected, or neonatal deaths. Next slide, please. So in terms of fertility, and this is also another question that has come up quite often for those of us who are OBGYNs, there have been unfounded claims, again, linking the vaccination to infertility, and all of those claims have been scientifically disproven. So if patients are interested in considering future pregnancies, you do not have to withhold the vaccination or recommend that they do not get vaccinated because, again, they're attempting pregnancy at any time beyond the time of their vaccination in women. In men, however, there may be some issues with semen quality as well as their reproductive potential in men who are infected with COVID-19. So for men of reproductive age, especially those that are planning pregnancies, it's even more critical for them to get vaccinated because the impact of the COVID-19 infection in men may be detrimental to their future fertility potential. So for our female patients that are interested in future pregnancy, for male partners of those patients, again, it's really important that they especially get vaccinated because of the impact of the infection itself on their male partner's potential for fertility in the future. Next slide, please. And what about breastfeeding in particular? Again, another common question. We do know that patients that have received the vaccination, there are SARS-2 immunoglobulins that are found in breast milk. So this may have the potential for passive immunity in these babies. And these were studied in both the Pfizer and the Moderna vaccination. Some information from the Academy of Breastfeeding Medicine. It's unlikely, again, during breastfeeding that that vaccine lipid would enter the bloodstream and reach the tissue in the breast. And also very little risk, again, for the child, but may have some plausible benefit, as I mentioned, because just like in any other situation, antibodies are transferred from the breast milk to the infant, which may theoretically, again, protect them from infection with the SARS vaccination. So vaccination, again, in women who are breastfeeding or lactating should not affect the safety of that, and they may continue to breastfeed even though they've recently received the vaccination. Next slide, please. So again, this is just the slide talking about some myths versus fact. We've already alluded to the infertility risk, which again has been refuted in terms of the vaccination. Again, it is not a live vaccine, so unlike other vaccines, which in pregnancy we may not give because of its live nature, this is not one of them. So again, vaccination for the COVID-19 vaccine is recommended. Next slide, please. So we will have a lot of time and be able to have a lot of your questions answered, hopefully in the Q&A or in the chat with the help of my other colleagues. But I guess the main take-home message is talk to your OBGYN or your obstetrical provider or your other healthcare professional. We found actually that non-OBGYNs also need this valuable information so that they can appropriately advise their patients about what to do. We have the expertise, as I mentioned, for pregnant persons, lactating persons, and those interested in becoming pregnant. So if you do not know the answers to those questions, really would like to, advise you to, refer your patients to those who may have some more information. We already talked about the increased risks of COVID-19 infection and the severity of the illness if you do get sick. So the goal is really to prevent you from getting those severe illnesses, being hospitalized, dying, or being admitted to the ICU, or being on mechanical ventilation. So that's the end of my presentation. There are some questions that may not apply to me and I may not be able to answer, but hopefully some of my colleagues can help with answering some of these questions.
So thank you very much, Dr. Claire, for that really wonderful presentation. So again, thanks. I see a question about a person would like to know any results from studies on fertility issues for those receiving any COVID vaccine.
So I think as we mentioned, I'm not exactly sure what she means in terms of fertility issues, but again, as mentioned, for those who've received the COVID vaccination, it does not impair your ability to get pregnant. So if there are issues with getting pregnant, it may not be attributed to the vaccination, and that would require a conversation and a workup with your OBGYN provider regarding any fertility issues that you may have. Maybe incidental, but not related to the vaccination in terms of the studies that we've seen.
I see also there's a question that says that several OBGYNs are very behind on appointments and cannot provide appointments or answers to some of our moms regarding the vaccine. What is recommended?
So I think there is a lot of good information, again, regarding the vaccination in the ACOG patient-facing website. So I do refer a lot of my colleagues to that to help our patients directly get information. Again, I will put it in the chat, or if someone can put it in the chat for me, it is www.acog.org/women's-health. I think several OBGYNs are challenged with a lot of the issues faced to really trying to take care of patients who were not getting care, in person during the the height of the initial wave of the pandemic. And I believe people are really sort of trying to catch up to the regular routine care needs of their patients. And so, again, if you need any help in finding some resources, please reach out to us. We have an office in Albany, a District 2 office in Albany. Again, it's on the ACOG website /District 2. And if you need help in finding someone, an OBGYN that can address the questions that you have for your patients or particular patients, we'd be happy to assist you in that process of finding someone for your patients.
Great, and somebody did put that into the chat for you, for everybody, not for you.
Thank you, Dr. Murthy.
Okay, there's a question, and I'll ask my colleagues. I'm mainly seeing the chats. I'm having trouble picking up the Q&A, so I'll have others call those out.
I can take care of the Q&A for you, Mila, after you're done with the chat, or we can alternate, whatever you want to do.
Yeah, let me do one more from chat, and then you can add some others. So it says, people that have ovarian cysts and have never been pregnant but planning, is it recommended to receive the vaccine?
Yes, the answer to that is yes. The ovarian cyst part is a separate issue, but same thing, planning a pregnancy. Yes, go ahead and receive the vaccination if you wish to. Yes.
One other question that's popped up, what about patients who have had the virus and want vaccine all during pregnancy? Is it necessary?
Yeah, I mean, again, I would love for my colleagues to weigh in on that a little bit more. I would probably venture to say yes, to go ahead and get the vaccination during pregnancy, but I don't recall or know myself if there's any issues with being infected and not being able to get the vaccination. If others have any opinions, I would defer to them, but as far as I would say, there would be no reason not to get vaccinated, but I'd be happy to hear any other opinions if others have different opinions.
I don't know if Dr. Rosen or Benko want to add to that. We do recommend people get vaccinated, even if they've had COVID. Anything else either of you want to share with that?
Hi, I would just add that there's no minimum amount of time you need to wait between being infected and getting the vaccine, other than if you are currently infected and still within the period that you need to stay home and isolate, which is typically a period of about 10 days, then you should not go to a vaccination site, and that's because we want to avoid infecting other people.
So the pregnancy part in of itself is not an issue. It's mostly, it's the same recommendations as if you were not pregnant.
Exactly.
Thank you.
Okay, we have a request in the Q&A. Can you go back quickly to the comparison chart of fertility issues with and without vaccines? I think maybe this means the complications of pregnancy chart.
So can you go back maybe 2 or 3 slides? So this is not for people who are trying to get pregnant. These are people who have already been pregnant, and what are the risk of these complications, meaning without the vaccination, and this is in comparison to those who've received the vaccination. So as you can see, again, pretty much either lower or comparable rates from the background rate of these pregnancy complications, even in those who have gotten the vaccination.
We have a question. Can the vaccine make your chances worse if you already have fertility issues such as PCOS?
So it's not, no, there are not any additional risks because of the vaccination. Any issues in terms of becoming pregnant that are related to any medical conditions really should be evaluated completely by your OBGYN provider or your GYN provider, not related to the vaccination itself.
We have a question unrelated to women's health specifically. What do you suggest we do if a client is administered the first dose but refuses the second dose?
Well, my colleagues may know the numbers better than I do from the 1 dose compared to the 2 doses. I believe there is some effectiveness from a single dose, not as high as the 2 doses. In the Pfizer and the Moderna, it's about 94 and 95% effectiveness, and it's less, probably, I don't know the numbers exactly, in the 60s, I believe, from what I've read, from a single dose, but I'd be happy to have my colleagues fill me in with the right data for a single dose.
Another question, are there any findings on J&J affecting the baby in a pregnant woman?
So, and I just want to answer the question. Dr. Murthy is sort of my wing woman, so I appreciate that. A single dose of mRNA vaccine is about 80% effective after 2 weeks. So thanks, Dr. Murthy. Appreciate the tag team.
I would also just add that the other issue with a single dose is we don't know how long the immunity from a single dose is going to last compared to the 2 dose, because the studies, of course, were done with 2 doses of the Pfizer or Moderna.
You can advance to the last slide, actually, while we talk.
Then to repeat that question, any findings on J&J affecting the baby in a pregnant woman?
So, many of the original studies the clinical trials did not include pregnant persons in the trial. So we do not have that information to date on any of the vaccines available. Pfizer has started pregnant women in their phase trials now, but the original clinical trials did not have pregnant persons in it. So I do not have information on any of the vaccines and those long-term effects.
Any information on vaccines in relation to causing autism or any other similar diagnosis?
I think the data on vaccination and autism has been well refuted. There is no information regarding vaccinations in general and causing autism. Again, we don't know the long-term data regarding the COVID-19 vaccination, but in terms of other vaccinations, that has been well reported right now in the literature to not cause autism.
Last one I have right now in the Q&A, studies show that some women who had the virus transfer the antibodies to the child. Would the same apply to the vaccination transferring the antibodies to the child?
I mean, in theory, you would think yes, but again, we just don't have that long-term data right now regarding that because, again, pregnant persons were not included in the original trials, but hopefully some of that information will come out shortly and we'll be able to answer those questions for you.
That's all I have right now in the Q&A, Mila. There may be more in the chat.
Yep, there's more in the chat. I saw, I have to go back. There's a question about will it affect if you have only 1 tube and are 42 years of age? And I think that's about vaccines and potential for pregnancy, if I had to guess.
Yeah, I think those are independent issues. Vaccination is independent from the other issues regarding becoming pregnant. As mentioned, again, the vaccination itself won't affect your future fertility. Other issues regarding being 42 years of age and having 1 tube and becoming or desire to become pregnant is a separate issue to definitely speak to your OBGYN provider about what is your options for that, separate from the vaccination. Dr. Murthy's providing a lot of good information to assist me in the chat, so I appreciate that. No preservatives like the Marisol in the vaccination. That's regarding the issues with autism. 1 case report from a woman who received Moderna at the time of delivery, and those antibodies were in the cord blood. So don't have a lot of data, but 1 case of that.
So I have a question here that's not for Dr. Claire, that's for our DOHMH team. It's a bit lengthy, I'm going to read it. If someone has already had COVID, should they get 1 dose of vaccine or 2? And this person says that they've heard that the reaction to the first dose for post-COVID patients is as bad as the reaction for the second dose for others. This has caused emotional distress for people as they relive the trauma of having COVID. Is the second dose necessary for these people? So I'm going to let our team handle that.
Sure, I can take that one. 2 doses of Moderna or Pfizer vaccine are recommended regardless of whether somebody has had past infection or not. And that's because the clinical trials were designed to look at effectiveness as a 2-dose series. And we don't know how long protection from just 1 dose would last. We know that protection is likely to last longer by getting that second dose. But it is important, as you mentioned, to be aware that side effects can occur, and they're very common, regardless of whether someone has had past infection or not. But fortunately, the symptoms, the side effects are typically mild to moderate and only last a few days after vaccination.
Right, exactly. They are short-lived side effects. Thank you. I don't see any other chat questions that are popping up. So
I have another in the Q&A.
Great.
Can the vaccine affect your hormone levels and menstrual cycle?
Yeah, I've heard a lot of sort of questions regarding that. I think it's really been sort of incidental. I don't have the evidence regarding specifics regarding the vaccination and effects on menstruation. It could be sort of just incidental. Your menstrual cycle can be affected by a lot of things, including stress. And so I don't have any evidence for that right now, but I would say we hope to hear more as we get more information. So I don't have any data. I tried to look for that, but I didn't find anything. Be happy to follow back up with folks as I look things up and provide that for the team if I find any other data about that.
Another one, how would you educate teenage mothers as it relates to the COVID vaccine versus actual COVID-19?
I think my counseling would be exactly the same. For pregnant persons, regardless of their age, now over age 16 is now available. I would also recommend that they get the vaccine as for patients that are, adults. So no change in my recommendations for the patients, because as mentioned, the severity of the illness, if patients do become ill with COVID-19 during their pregnancy, that's the most important thing we want to avoid. The death, the hospitalizations, the ICU admissions, the mechanical ventilation. We want to avoid those severe risks in those who are pregnant.
So there's some other chat questions coming through that are more general, not specific to women's health that I can see. There's a question about how long immunity lasts for Moderna. Someone's asking if it's 6 months, and there's a subsequent question about will we need booster shots on a yearly basis. And I can say, and I will let our team weigh in if there's anything to add. At this point in time, we do not yet know if people will need booster shots, but that is all being studied at this point in time, from what I understand, and we really don't know how long immunity will last. Anything else?
I would just add, I think there's a messaging problem here that when Pfizer or Moderna come out with a study that says immunity lasts 6 months, people take that to mean immunity only lasts 6 months. And so that leads to a lot of misunderstanding.
Absolutely, that's a good point. I see 2 questions, one for Dr. Clare, so I'm going to ask this one. Somebody asked, what about pregnant clients under the age of 16?
So I don't, other than a clinical trial, they have clinical trials up to starting from age 6 months. and greater, it's not really available outside of a clinical trial for younger than 16 is my understanding. So if you're over 16 and pregnant, you can definitely obtain it without an issue. Under 16, probably through a clinical trial would be the way to get the vaccination.
And I think I would just add that again, that the 12 to 16-year-old age group is being studied right now. And I think future DUAs with the FDA I'm sure are in the works.
And Dr. Murthy says the trial slots are now full, so only vaccination under 16 through a trial. So if that becomes opened up, that would be the opportunity again.
So there's a question, a broad question about a side effect. Recently, I've heard some having tingling overall in the body after having their vaccine, with asking if there's any information there. Dr. Rosen or Benkel, either of you want to take this one?
Sure, Dr. Benkel had to hop off, but tingling is not something that is reported as a common side effect based on the clinical trials. So that's sort of a more unusual side effect. I would encourage somebody to contact their medical provider if they have those symptoms, as it could certainly be related to something else of concern.
Great, thank you. There's somebody asking, will the vaccine become mandatory? And I will just say at this point, people are not mandating the vaccine at this point. Okay, I'm not sure I see, one more question maybe. Are there any results from studies linking memory issues to recovering from COVID or from the vaccines? And maybe Dr. Rosen, is that something you can speak to?
There have been people with reported symptoms that after COVID infection that can persist for longer periods of time, and sort of a foggy brain is something that has been reported. That is not something that was reported as a safety concern after vaccination from the clinical trials.
Exactly, and more reason to encourage vaccinations so that people do not get COVID, and then don't have to, have long-term side effects from it. Okay, I'm going to just, interest of time, there's about 9 minutes left, and people, if there are still questions coming up, please put them in. If you have questions, again, regardless of women's health or otherwise, vaccine confidence building, things related to your work site, please share those questions. And if we don't have answers today, I promise that these are ongoing conversations, and we're going to want to know the kinds of things that you are grappling with so we can talk about it together. Go back one slide for me a second, please. I just want to, I know this was up, I just want to point out the resources on that are up to date about COVID-19 from our website. So, our health department has lots of information on the vaccine, and that's this website here, nyc.gov/COVID vaccine. We have a vaccine tracker, and that is here as well, COVID-19 vaccine.health.ny.gov. I think that's probably supposed to say health.nyc.gov. I'm not sure, but that would be my guess, and that's COVID-19 vaccine tracker. There's information on the Vaccine Command Center for New York City at nyc.gov/VCC. And then the most recent health alert that we put out, which was about the cases of cerebral venous sinus thrombosis related to thrombocytopenia after the J&J vaccine, and you can get that on our website as well. The next slide is really just Next slide, please. Maybe. Is a way for you to email us with questions in between these sessions at ICS-MH-D officer@health.nyc.gov. And there is a survey that we sent out, I believe it was the other day this week, and we'll make sure to get that out and around again to the attendees of this session, that is asking for your ideas about future topics and potential speakers. And what we want to do is move towards ideally hearing from each other on some of the issues you're grappling with as providers, where there might be somebody who's already taken a stab at working towards one of the more challenging issues, so that you can learn from each other. So I just want to make sure that we hear from you about the kinds of things that you're grappling with, so that we can make these sessions meaningful to all of you, or as many of you as want to be joining us to have these conversations. And so again, I don't think you can click on that link for the brief survey on your screens. At least I don't seem to be able to, so I'm sure you can't. But we will make sure that that gets out and around. And if people have topical areas they want to throw out in the remaining few minutes of today that you want to hear about, please share that with us so that we could make sure that we know what's on your mind. So I'll give you guys, another second to throw any more questions out there.
We have another question in the chat. Is it safe for men with enlarged prostate glands to get the vaccine?
Definitely not for me.
Dr. Rosen?
I'm so sorry, I missed that question.
Is it safe for men with enlarged prostate glands to get the vaccine?
Yes, that is not a contraindication to vaccination.
So while you guys are deciding if there's any more questions, our next webinar is going to be on Wednesday, May 5th from 4 to 5 p.m. Be on the lookout for invitations. And again, that survey I mentioned, we are going to keep open until Monday, the 26th at the end of the day, like 5 o'clock. And so again, we want to hear your ideas that you are hearing from clients, from staff, from family. Again, really, we want it related, though, ideally to behavioral health providers, and helping you all with vaccine confidence and returning to workplaces and those sorts of issues that we know can be and have been somewhat challenging. So, Bill, are there any other questions that you can see from a Q&A perspective? I don't see.
No, I'm not seeing any.
Okay, so at this point, I really want to thank Dr. Camille Clare. I think you got some shout outs in at least in the chat box that I saw. People were very thankful for the information you shared with us, and for your expertise in this topic. And again, we were trying to be responsive to what people were telling us they wanted to hear about. So I'm hoping that we were able to meet those needs. But really, thank you for joining us in this presentation and for your time. And thanks to the rest of the panelists, and to all of you who have joined us and participated in this webinar. I just want to close out by saying thank you to each of you who are out there working with clients day after day, or supporting the work of clients in any way when it comes to behavioral health. And so really just huge kudos and thanks to all of you out there doing the hard work in this really challenging and trying time. So I thank you for joining us. I'm going to have us close out, and we will hope to see and hear from the rest of you in 2 weeks' time. Thank you very much for joining us.
Thank you.